Welcome back. The Community Health Worker Certificate Training Program at Hostos Community College offers students the opportunity to obtain a Hostos certificate that allows them to earn up to 9 college credits if they enroll at Hostos or SUNY Orange. The apprenticeship program works with participating employers to provide on the job experience while workers complete 144 hours of related instruction focused on core CHW competencies that employers are seeking. The Community Health Worker Program Manager at Hostos, Jaunia Clarke, joins me now to discuss more. Good morning. Thank you so much for joining us.
Thank you for having me.
Absolutely. So, to kick things off, tell us a little bit about the Community Health Worker Training Program at Hostos and what makes it unique.
All right, awesome. So yeah, our community health worker training program is in the Division of Continuing Education and Workforce Development at Hostos. And most recently, we've been awarded funding from the Health Resources and Services Administration to train 270 community health workers here in the Bronx. That is really important because we need to build a public health workforce with community health workers as well as other health support workers. What makes it unique, our program is held online right now, so it's virtual. It offers an opportunity for those who, may be working during the day, they have families at home that, they're interested in a training program, but they can't go in person. So this offers them that opportunity to complete the program. And as you mentioned earlier, they also have the opportunity to earn those college credits. So up to 9 credits in either our community health degree program at Hostos, and then also the apprenticeship opportunity. So we are looking for employers for our participants to do their apprenticeship hours and just get those hands-on skills within the field.
Yeah, absolutely. I think the flexibility and accessibility is so important. I know definitely during that COVID time that we were in, everything was online, and
Yes.
it made things a lot more accessible for people.
Yes.
So with that, I wouldn't say we're in a complete post-COVID world because it's something that unfortunately is still here and still
Yes.
standing, along with other viruses and diseases, spreading around. Right now, we're in flu season. So tell me, why is training community health workers so important in today's world?
All right. So yeah, we're still reeling the effects of COVID. Some people think that it's gone, but during that time, a lot of our community members they lost trust and faith in the healthcare field. So that's why community health workers are so important. They are the ones who have those lived experiences with our patients, the clients that they're engaged with. They have those experiences to say like, hey, I went through that. Let me tell you how you can navigate this challenge that you may be having right now. So it's really important for our community health workers to be out there and engaging with the communities.
Of course. And so tell us a little bit about what kind of training the program provides and how it prepares participants for real world healthcare challenges.
Right. So again, the program is at no cost. So this is a big deal for our trainees and participants. They can participate in 3 classes. So the first would be the Intro to Community Health, which lays the foundation for the work that they're going to do. Then they participate in interpersonal communications class training. So learning those interpersonal skills. Communication is really important. If you're a trust worker in that community, you're represented, of language, the cultural background. So that's really important that you know how to communicate and navigate conversations with individuals. Then we also have a medical terminology course. Again, dealing with chronic diseases. You need to kind of know what that means in that sense, especially if you are working in a clinic setting. So those are the 3 basic classes that we offer. And then we also offer CPR training, as well as mental health first aid training with one of our partners. So there's a lot of opportunity outside of the class to kind of upskill and add things to your resume if you're going back out in the field.
Yeah, absolutely. And so you mentioned some of the overview and the courses that are offered. So tell me, are there any prerequisites or qualifications needed to enroll in the program?
Right. So only 2. You need to have a high school diploma or GED, and you need to be a U.S. citizen or have work authorization in the United States. So those are our two basic requirements. So if you are passionate about community health work, you're interested in learning more about the field, then definitely reach out to us. Again, just two minimum requirements there.
That's awesome. And just quickly, how, because we talked about just how flexible it is through the timing and other qualifications, how long does the program take, and what essentially is that time commitment?
All right, so it's approximately 5 months long. The classes are during the evening hours, so from 6 to 9 p.m., 3 times a week. Two of those sessions are synchronous, where you'll be meeting virtually with our instructor, and then that third session is asynchronous, so you'll have some assignments, some readings to complete on your own time. So again, that flexibility for our students and participants.
Yeah, of course. And after they graduate the program, what kind of careers can the graduates pursue, and what role do they play in improving community health?
Right, so obviously community health worker, but again, it goes by various names and related positions and roles. So we have CHWs that work as care managers, case managers, health educators, community outreach specialists, and we've even had CHWs that have participated in the training and upskilled to become community health worker supervisors. They've gone on to nursing school. So there are a lot of opportunities, even social work, because it's all intertwined into the community health field.
Right. And how does this program particularly impact the communities it serves, specifically, the communities where Hostos is active?
Right. So it's really important because it's representative of the community, right? So CHWs, they live, they work in the communities that they serve. So if you are getting this training, you are going out there to say, hey, I've taken the time to kind of upskill and enhance my knowledge so that I can better serve you as a community member, a client. We want them to, for example, a patient who might have asthma. Again, I go to the clinic setting, but
Yeah.
community health workers can work in various settings. But clinic setting, for example, a CHW interacts with a patient who may have asthma. And, they meet with the doctor for maybe 15 minutes. Doctors are kind of quick in and out. And say, yeah, you need to take your asthma medication and you'll be fine. But then they meet with the community health worker who gets into the nitty gritty of things to say, what else is going on? Then they realize, okay, this person has mold in their house. They have rent arrears. They've missed out on work because they've had an asthma episode.
Right.
So these are all things that go into making sure that the community member is well supported. And that's what the CHW is there for, to connect them to care, refer them to other things that they may need to make sure that holistically they are well.
I think that's so important because, a lot of times you see the doctor and you kind of just get a prescription, or you get any kind of medication just to target that specific problem. But how often is the underlying cause of that problem addressed? So I think that is so important in this case.
Yes.
And so with that, tell me, are there any resources that Hostos provides for the students going through this program?
Yes, absolutely. So they get a lot of resources. Each CHW is assigned a case manager to follow them throughout the program. Regular check-ins to say, hey, how are things going? Is there anything you need support with, in your own personal life?
Yeah.
Then they also get support from career specialists. So they'll meet with them to do resume building, mock interviews. We host regular workshops so that when they finish the program, if they are going out into the field, that they have that full support. Then they also do have a college transition counselor if that's the route that they do want to take after completing the program. So a lot of support. They also get stipends and other incentives to help support them through the program and make sure they actually complete it.
That's so great to hear, especially the case manager resource,
Yes.
because I think it's so funny because you hear people say that you cannot fill someone else's cup if yours is empty. So while they're
Exactly.
caring for other people, they also have somebody helping them and caring for them. So I think that's so important. And let's talk about the program and its alignment with broader public health goals, like addressing health disparities and improving access to healthcare.
Yeah, absolutely. So, for example, we know that the Bronx has seen one of the highest health disparities, so socioeconomic burdens. So, the community health worker training is there to equip them with those skill sets to help our community, rise up. And as you said, as I mentioned earlier, social determinants of health play a big role in what's going on with that individual and our community as a whole. So helping them find that support, broader public health, you mentioned flu season. We're always, keeping an eye out for what that next public health emergency is going to be, and just making
Right.
sure that our trainees are ready and prepared.
It's funny. I was actually just going to ask you, what role do the community health workers play in tackling diseases like COVID or chronic disease management, mental health? Tell us a little bit about that.
Right. So we help them build those skill sets so that they can do a lot of community outreach, right? During those times, the pandemic, we had to kind of go out and say, hey, we are here to support you as community health workers. People were shut in. They didn't have a lot of support. So CHWs are there to be that, person on the phone to call and say, hey, I'm going through something. Or, hey, I know that I need to go in and visit that person, my neighbor, who may not have access to food. Help them, get that support that they need.
Absolutely. And just, we have less than a minute left. So tell me a little bit, for people who are interested, where can they go? Where can they apply?
Right. So you can reach out to us directly at Hostos on our website. Just click on the Continuing Education and Workforce Development page. You can give us a call, 718-518-6656 for more information, or visit our office directly, 560 Exterior Street. We are open 9 to 5, Monday through Friday, and we are always welcoming individuals who are interested in our CHW program as well as other training programs that we do have.
Yeah, Jaunia, thank you so much for sitting down with us. This program, I think, is so vital and so important to the community. So thank you for coming out and telling us about it.
All right, I appreciate it. Thank you.
Of course. To learn more about these programs, please go to the website hostos.cuny.edu. Stay tuned. We have more open for you right after this.